I'll never forget the night when a doctor ordered me to discharge a patient, and every instinct I had screamed that doing so would be the worst mistake of my career. You know those moments when you're standing in a brightly lit hallway, listening to monitors beeping in rhythmic patterns, and somehow, despite all the noise, you hear something quieter, deeper, a kind of internal warning that has nothing to do with protocols or checklists. That's exactly what happened. I didn't know why I felt it, and I didn't have proof, but I knew I couldn't ignore it. And what happened later? Let's just say that the only reason I still sleep at night is because I listened to that instinct instead of the order. It was a Thursday night shift, one of those nights where the ER hummed with that particular energy that means your shift is about to turn into a marathon. You can feel it in the air. You can feel it in how the waiting room keeps filling no matter how fast you move patients. And you can feel it in your own body, like some sort of sixth sense built from years of experience, thousands of assessments, and more adrenaline spikes than you can count. I had been on for about 3 hours when the paramedics rolled in a man in his mid-50s. His face was pale. Not the kind of pale that comes from cold weather or bad lighting, but the kind that comes from inside. The kind you notice before you even consciously register it. His eyes darted around the room as though he wasn't fully sure where he was, but also as if he didn't want anyone to notice something he himself wasn't expressing out loud. He told us he'd been having intermittent chest discomfort. Not classic pressure, not sharp pain, not the textbook symptoms. But he kept using vague words like odd, tight, strange, and not right. His vitals weren't terrible. His heart rate was elevated but manageable. His oxygen levels were good enough that you wouldn't rush him straight into trauma. The paramedics said his ECG in the field looked unremarkable, and they mentioned it twice, almost as if they wanted reassurance from us as much as they were trying to reassure him. The attending physician on duty that night was someone I had worked with countless times. A good doctor, sharp, confident. But he also had that tendency some seasoned ER doctors get, leaning heavily on pattern recognition. You've seen something 1,000 times, so you assume the 1,001st will behave the exact same way. 99% of the time, that approach works. But it's the 1% that makes nurses like me listen to something beyond checklists. After a brief exam, the doctor said, "Let's keep him for observation, but I don't see anything concerning." He said it casually, almost dismissively, but I didn't feel casual at all. Something in the man's posture, something in the tone he used when he said, "I just feel wrong," didn't line up with his vitals or the initial tests. I tried engaging him while I placed the IV line. He was polite, cooperative, the kind of patient who doesn't want to bother anyone. But when I asked him to describe the sensation again, his left hand moved subconsciously toward his chest, even though he didn't say he was in pain. That small, involuntary gesture tightened something in my stomach. I've seen enough subtle warning signs in my career that sometimes a single movement tells you more than a blood pressure reading. We ran labs. Everything came back fairly normal. His repeat ECG still showed nothing dramatic. And because the ER was slammed, the doctor came by with a clipboard tucked under his arm and said, "We're moving him out. Let's get him discharged." I remember staring at the order like it was printed in the wrong language. Discharge him? Something was off. I couldn't explain it, but I felt it. Something beneath the surface of what we were seeing. Algorithms, guidelines, flowcharts. They all said he was okay. But his eyes said something else. They had a kind of unsettled fear that he wasn't voicing, like a man fighting the instinct to panic because he didn't want to seem dramatic. I approached the doctor and said quietly, "I don't feel good about sending him home." He raised an eyebrow. "His tests are clean." "I know, but something's not right. He looks like he's holding something back." He sighed, not impatiently, but like someone carrying the weight of too many decisions made too quickly. "We can't keep everyone overnight. If something changes, he'll come back." But that was the problem. Patients often don't come back until it's too late to intervene properly. They trust us to catch things before they become irreversible. And sometimes they minimize symptoms because they don't want to be a burden, or because they convince themselves they're fine. When I walked back into the patient's room with the clipboard, ready to go through discharge instructions, even though every inch of me resisted, I found him sitting very still, staring at the floor. Something about his posture struck me hard. He looked like someone bracing for something he couldn't name. "Are you sure you're okay to go home?" I asked. He swallowed. "I think so. I don't feel like myself." "Can you explain that?" He shook his head. "No, it's just a feeling." That word, feeling, hit me like an echo of my own instincts. I took a deep breath. I couldn't ignore this. My gut was practically shouting by now. And if I discharged him and something happened later, I would never forgive myself. So instead of handing him the discharge papers, I said, "I'm going to run one more set of vitals and get another ECG before you go, just to be safe." He nodded, relieved. So relieved that it made my heart skip. When I hooked him up to the monitor again, everything still looked stable. Nothing jumped out. Nothing screamed emergency. But right as I was finishing up the ECG leads, he winced subtly. So subtly I almost missed it. "Are you in pain?" I asked sharply. "No," he said quickly. Too quickly. Another alarm in my spine. I stepped out of the room and grabbed the doctor again. "Please," I said. "One more test. Let's at least keep him long enough to repeat labs." He rubbed his forehead. "We are at capacity." "I know. But something is going on with him. I can feel it." He hesitated, and that hesitation was all the opening I needed. "Fine," he said. "One more round, but we're not keeping him overnight unless something significant changes." I accepted that compromise. Another hour passed. His vitals fluctuated slightly, not enough for anyone but a nurse who'd been watching him closely to notice. His heart rate spiked briefly, then stabilized. His skin tone shifted from pale to slightly flushed, back to pale again. His breathing changed patterns twice. Tiny details, small ripples on the surface of something deeper. Finally, as I stepped into his room to check on him again, I noticed him pressing a hand to his chest, not directly over the heart, but to the upper left quadrant. His expression tightened for a split second. "That again?" I asked gently. He looked embarrassed. "It's probably nothing." No. Nothing doesn't make grown adults instinctively hold their breath while they wait for a sensation to pass. At this point, I wasn't thinking about paperwork or workflow anymore. I wasn't thinking about how the doctor might roll his eyes, or how the other nurses might tease me for being overcautious. I was thinking about the single, unmistakable truth that every nurse eventually learns. It's almost never nothing. Right then, right there, his monitor flickered with a small irregularity. A tiny one. The kind of blip you could dismiss as a lead placement issue. But it wasn't the lead. I knew it wasn't. I leaned closer. His breathing sped up, not dramatically, but perceptibly. "I'm going to stay with you a moment," I said. "Am I okay?" he whispered. There it was. The question patients only ask when they're afraid of the answer. "You're here," I told him. "And we're watching you." But even as I said it, the irregularity appeared again, slightly longer this time. Something was escalating, and I knew we were seconds away from a turning point. I stepped into the hall, flagged the doctor again, and this time I didn't sugarcoat anything. "You need to assess him again right now." He opened his mouth to object, but before he could, I pointed back into the room. "Something's changing. Trust me." He followed me in, and that's when everything shifted. Not dramatically, not explosively, but unmistakably. The patient's expression tightened. His hand moved again. The monitor showed a pattern that shouldn't be ignored. And in that moment, the doctor's whole demeanor changed. He saw it too. He looked at me and said quietly, "Good call." But the story didn't end there. What happened over the next few hours proved exactly why sending him home would have been one of the greatest mistakes of my entire career, and why sometimes a nurse's intuition is the only warning sign anyone gets before a situation turns into something far worse. And it all started unfolding faster than any of us expected. The shift in the doctor's expression confirmed what I had been feeling from the beginning. We were standing on the edge of something that could go wrong fast. He stepped closer to the monitor, watching the rhythm flatten into an odd inconsistency. Not enough to trigger the alarm, but more than enough to raise every red flag in the room. "Let's keep him on continuous monitoring," the doctor said calmly. But I could hear the undertone, the seriousness he hadn't shown earlier. "And draw another set of labs. Full panel." The patient swallowed hard, trying to steady his breathing. "Is everything okay?" I gave him a reassuring nod, even though the knot in my stomach tightened. "We're just being careful. You're in the right place." But the truth was, by then I was convinced that if he had gone home when the discharge order was placed, things would have spiraled into a situation no one wants to imagine. Sometimes the difference between a stable patient and a spiraling one is just a handful of minutes, and we were standing in those minutes right now. I stayed at his bedside as the doctor left to put in orders. The patient kept glancing at me like he was searching for someone to anchor him, someone who wouldn't brush off what he'd been feeling. There's a specific look people get when they're afraid to voice their fear out loud. It's the human instinct to pretend everything is manageable. But the body betrays confidence long before the mouth does. "You're watching me closely," he said quietly. "Yes," I admitted, "because you're giving us signs you might not realize you're giving." He let out a shaky exhale. "I can actually feel something now. Something different, like something is tightening inside." I didn't leave his side. The labs came back with slight abnormalities. Not enough to declare a crisis, but enough to hint that something was brewing beneath the surface. The doctor's face turned thoughtful as he reviewed them. He didn't question me anymore. He didn't question why I'd pushed. He simply walked back toward the patient's room with purpose. "We're admitting you for further observation," he told the patient. The man looked relieved. Terrified, but relieved. "Thank you," he whispered, to both of us. But before we could move him upstairs, his breathing changed again, this time in a way that made every cell in my body go on alert. It wasn't dramatic. It wasn't loud. But it carried the unmistakable cadence of someone on the edge of a deeper event. He leaned forward slightly, gripping the bed rail, and I immediately placed a hand on his shoulder. "What are you feeling right now?" I asked. "Pressure," he said. "Not sharp, just pressure. More than before." I didn't waste a second. "Doctor, I need you, now!" The attending rushed back in. The monitor reflected exactly what I feared. A clear, undeniable irregularity. Not subtle anymore. Not debatable. Something significant was happening. The doctor's tone shifted instantly. "Let's get him on treatment protocol." The room accelerated. Nurses moved rapidly. Medications were drawn. Oxygen was placed. The patient began sweating lightly, his skin clammy in a way that no longer looked like anxiety, but physiology. His eyes met mine, wide, frightened, searching. "I'm right here," I told him. "Stay with me, keep breathing. We've got you." The doctor was giving orders faster now, precise and calm, but with a tension that told me he realized how close we'd been to making a terrible mistake earlier. If we had sent this man home, he would have been alone when these changes hit. Alone with pressure building in ways that would have turned into a crisis before anyone could reach him. But here, in the ER, surrounded by trained eyes and hands, he had a chance. His condition worsened for a few minutes. Those heavy, suspended moments where time stretches and every second feels like a question. But then slowly, his body responded. The monitor steadied. His breathing evened. His grip on the rail loosened. The terrifying tension in the room dissolved inch by inch. The crisis began to pass. When the doctor finally stepped back, letting out a breath he'd been holding, he looked at me with an expression I hadn't seen on him before. Gratitude, mixed with something like humility. "You were right to push," he said quietly. "Good call. Really good call." I nodded. But the truth was, it didn't feel like pride. It felt like relief. The kind that makes your legs feel a little weak. The kind that reminds you exactly why instincts matter in medicine. Not because they're perfect, but because they fill the gap between what tests show and what the body is trying to say. The patient, now stabilizing, looked at me with watery eyes. "If you had let me go home," he started, but his voice cracked before he finished. "You're here," I told him gently. "That's what matters." He mouthed a quiet thank you, and I'll never forget the sincerity in his expression. It was the kind of gratitude that sinks into your bones and stays with you for the rest of your career. Later, after he was moved upstairs for continuous monitoring, the doctor caught me at the nurse's station. "You fought for him," he said. "You didn't have to. You could have followed the order and walked away." "I couldn't," I replied. Everything in me said he wasn't okay. The doctor nodded. "Never stop listening to that. We don't talk about it enough, but nurses see things before the rest of us do. There's value in that, more than most realize." When my shift finally ended hours later, I walked out into the cold night air feeling drained but steady. I didn't need praise. I didn't need acknowledgement. I just needed to know the man upstairs was safe. And he was. He stayed in the hospital for further evaluation, and the underlying issue he'd been struggling with was finally caught and treated properly. If he'd gone home, the outcome could have been disastrous. But because of persistence, because of listening to something deeper, he lived to walk out of the hospital on his own 2 feet. People often ask what the hardest part of nursing is. They expect answers like the exhaustion, the long shifts, the emotional whiplash. And those things are real, but nights like this remind me of something else entirely. The hardest part is carrying the quiet knowledge of the things that almost happened. The disasters that hovered on the edge of unfolding, but didn't, simply because you refused to ignore a feeling you couldn't explain. And this night? This was one of those nights. Thank you for listening to my story, and for staying with me through every moment of this shift that could have taken a very different turn. Your time means more than you know, and sharing these experiences helps honor the instincts that save lives every single day. If this story resonated with you, don't forget to subscribe, leave a comment, and share it with someone who loves real-life medical stories. Your support helps these experiences reach more people who need to hear them. Thank you again for being here. Stay safe, stay aware, and trust your instincts. They're often speaking louder than you realize.